Good afternoon, everyone. I'm just going to give everyone one more minute and then we will get started. I am recording this presentation and hopefully everybody able to connect in. All right, I'm going to get started. I know people will be joining us, but I always like to make sure those of us, everyone who's on time, that we try to start promptly. I'm Sue Glore. I'm the Senior Regional Director here at the Lupus Foundation of America for the Northeast, and I'm super excited to be with you today. I wanted to introduce my colleagues who will be here supporting the program and helping you throughout the course of the program this afternoon. Alicia Scott is our going to be managing our chat box. Alicia, give a wave. Alicia also is the person who coordinates these programs for us and has done a great job of putting a wonderful presentation together. Alicia also will talk a little bit about some of the events Alicia's involved in, but she's located in Connecticut. Next, we have Jessica Orr. And Jessica is our development manager in New York City and works on the New York City Walk as well as some other events. So Jessica, if you can say hello. And then Michelle Inslee, who joined us in January. So some of you may not have met Michelle yet. And Michelle works on our Boston and Hartford events, and she's located in Massachusetts. For our presentation today, I'm just going to ask some housekeeping. We do have a chat box on the bottom of your screen or your top of your screen. You should see a kind of a cartoon bubble. That is the chat box. We'll ask you to use that today for your questions. Alicia will also be sharing links throughout the presentation. So if there's information that you're looking for or if something gets mentioned, we're happy to share links. We do commit to answering as many questions as we can today. And for those we don't get to, we do commit to following up. We're recording the presentation, so we will also have that available afterwards. And other housekeeping, I think just ask that everybody, if you're not presenting, to stay on mute just so everybody can hear. But it's just wonderful to see some familiar faces, some new faces, and we have a great program today. So I want to start off by thanking our sponsor for this event, Us and Lupus, and Arnita Roberts-Christie, who you know, who's been part of our Northeast family for quite some time. She'll be presenting a little later. But we're going to start today with our two presenters. First, Dr. Laura Geraldino-Pardilla. She's an associate professor and director of the Lupus Clinic at Columbia. Her areas of clinical and research interest include systemic lupus erythematosus, rheumatoid arthritis, and musculoskeletal ultrasonography. Boy, that's a mouthful there. And then following her will be Dr. Monica Blied, who's with us from California. She's a clinical psychologist and the founder of Faces of Health Wellness Center in Claremont. She specializes in providing integrative care to adults with chronic medical illnesses, and she has expertise in the mind-body health connection. So we're incredibly excited to have both of them. I'm going to turn it over to Dr. Geraldino-Pardilla first, and then we'll have Dr. Blied present, and then we will open it up to questions. I said, if you have thoughts come to mind or questions while they're presenting, please put them in the chat box, and Alicia will be capturing them for when we get to the Q&A. So without further ado, I'm going to turn it over to you.
Thanks. Let me make sure everybody can see that well. Yes.
Yeah, it looks great.
Very good. So I'm very happy to be here today talking to you guys about a topic that's very dear to my heart. So it's about lupus and the heart. So with no further ado, let's get started. Some of the objectives of things that we will cover today is understanding some of the complications that can happen when the lupus affects the heart or the blood vessels associated. Also, we will we will discuss some of the ways that we can identify that inflammation in the heart. How can we diagnose that, treat it early? And finally, we'll talk a little bit about some of the abnormalities that can happen in the heart rhythm in lupus. So looking at this graph, what we are seeing here is survival in lupus. So we have come a long way in the last few decades. So we see that, for example, back in the 1950s, once somebody was diagnosed with lupus, the 10-year survival was pretty grim. It was about half of the patients that would be alive 10 years later. So we've done so much better, and that's great. So now we are around the 80s to 90%, 95%, and that's since the 1990s. But thinking about who gets lupus, and mainly young people, right? It's still not great. So we are still seeing that somebody with lupus has 3 to 5 times higher mortality when you compare them to somebody that doesn't have this disease. So because of that, now that we see that people with lupus live longer, different issues arise. So some of the main causes now of death is heart disease. So what happens is that we see that, in the past, it was more like immediate complications from the lupus because we didn't have many medications, or the medications were too toxic. But now we're seeing that there's longer periods of course, of living with the ups and downs, flares that can happen in lupus. And with that inflammation comes some risks to our hearts and also to the blood vessels. So with lupus, we see that there's double the risk for having heart disease when you compare that to no lupus. And it's both those common risk factors that we know can contribute to having heart disease in just anybody, but it's also things that are specific to the lupus. The lupus itself gives us greater risk for having these complications. And what we're seeing here in this graph, let me make sure my pointer is out there, is everything we see to the right side of the middle line are studies that have shown that there is an increased risk specifically for heart attacks with lupus. And we see that in most of the studies, different cohorts, different numbers of patients, large, small, we see that there is that increased risk. And especially here, what I circle in red is that when we see the younger people, people 35 to 44 years of age, when you compare them to a 35-year-old who doesn't have lupus, then we can even see a risk that's listed as 50 times more likely to have a heart attack, because we're not expecting normally heart attacks to happen in young people. And sometimes that's why things are not diagnosed early on, because it's just something that is not thought of unless you're really looking for it. And when we look at, so what can happen with heart attacks or any kind of, untreated inflammation to our hearts, is that then the heart stops functioning properly. So it stops pumping the blood as normal as it would under other circumstances. And we can start having symptoms of either, chest congestion, difficulty breathing, not being able to exercise. And these conditions are called heart failure. It's when the heart is just not working properly. And when we look here, what this graph is showing us at the bottom is the control. So people that don't have lupus. In blue is the men and red is the women. And we see that normally, like middle age, once we start hitting middle age, that's usually when people start having some heart disease and can develop heart failure. The older we are, the more likely that can occur. And in general, heart disease is the most common cause of death in the population in general. So not just in lupus, but what we see in lupus is that instead of that risk starting later on in life, we see that even in very young age, we see this jump in the risk for having this heart failure. And we see the men are always more, just being a man is a risk factor for that. So the men are a little higher, but we see, early, jumping even in the teenage years to the 20s, we see the big increase in that risk and the big difference when you compare to not having lupus. So this all points out that we have to be monitoring and making sure that we're taking care of our hearts as best as we can so that this doesn't happen. And it becomes even a bigger risk when we talk about nephritis. So anybody with lupus who has had involvement of the kidneys, which is
Good
called
afternoon,
lupus
Dr. Fishkin's
nephritis,
office. Lee speaking. How may I help you?
um, so we see that with the nephritis, that risk is even higher. So what we have here at the bottom in the black dotted line is the controls again, so people without lupus. What we see here in the yellow is, or orange, is the lupus patients that don't have any kidney disease. They have not had lupus nephritis. So there's a higher risk than the general population, but nothing compared to once the kidneys have been involved. So if you've had lupus nephritis, and that's even more important to be screening for how the heart is doing and making sure that risk factors for heart disease are being looked at and treated so that we don't get these complications or heart failure, knowing that there's even a greater risk with having nephritis. And like I said, so it's both traditional risk factors. So for anybody, the older you are, so usually after age 65 is when heart disease starts to manifest. Men, as I mentioned, are at higher risk. If you've already been diagnosed with having what's called coronary artery disease, that means that the blood vessels to the heart are either occluded or the flow doesn't go very well. That's also a big risk factor. If you've had a heart attack before, high blood pressure is the most common and greatest risk factor for heart disease in general and heart failure. But it could also be if the valves of the heart are involved. Sometimes they don't close or open properly, and that puts a lot of strain in the heart. Or anemia, because what happens when we're anemic is that the heart has to compensate and beats very fast, but at the same time, that makes that heart muscle get bigger and can get sick from that. And having chronic kidney disease. When the kidneys are not working properly, then our bodies cannot handle the fluid in a normal way. So we're retaining fluid, putting more burden on the heart, and that's always associated with greater risk for heart disease and heart failure. But what we see here also, if you look at this list of risk factors, is that having lupus on its own, even not, after you account for all of these other risk factors, just having lupus on its own can increase that risk by 3 times of having heart failure, even if none of these other risk factors are there, which is what sometimes makes it tricky for physicians to then try to identify who is at highest risk for heart disease, because they're usually screening for your blood pressure, for how your heart looks on echo, for example, if there's anemia, all of these things, but just lupus on its own can be a risk factor, and that can make it a little harder. So what is it that happens with the lupus? How does this risk come about? So we know that one of the main abnormalities that can happen, or changes that can happen to our blood vessels, is that cholesterol and calcium can deposit in the wall. So we can see this is imagine this is one of our main blood vessels, and this starts to deposit around the vessel. You can see that then blood flow is not going to go very well, very smoothly, because it's getting occluded more and more. And this is just cutting it a different cut so that you can see how much the blood flow could be reduced. And with that, this is something that's called atherosclerosis. Something that can trigger these changes is inflammation. So knowing whenever we have a lupus flare and inflammation happens, we can see it sometimes in the skin and the joints, but it's really inflammation that is happening in the entire body. And some of the changes that inflammation can cause are these changes in the blood vessels. So because of this process of atherosclerosis, which means this buildup in our blood vessels that can make them hard and thicken and just make them not work properly as they were meant to be, then we see this this higher risk for than heart disease. And in general, we see that there's a 2.5 times greater buildup of this cholesterol and calcium when we have with lupus itself. And it's because of that inflammation that can occur. And this is how that would look, in real life, in an actual image. So what you're seeing here, this is the heart, and this lines here are blood vessels. So these are the blood vessels that are feeding the heart. Of course, the heart needs its good blood supply so that it can function normally. So this interruption here in the dye, that's just dye that's given to the blood vessels so that we can see if they are open or narrow. So that interruption there is a big blockage. So that's what that calcium and cholesterol deposit can cause. Blockages to those vessels, and then that's how heart attacks happen. Once there's just no blood flow that's getting to the heart muscle, then a heart attack happens and that muscle starts dying out because it doesn't have any blood supply. So that's one way that that can be seen. So that was a little bit on what can happen to the actual blood vessels that puts us at risk for heart disease. But also with lupus, we can have inflammation in any part of the heart. So it could be either the inside of the heart. So for example, the valves that allow for blood flow to come up and down in between the different chambers of the heart. So it could be that they're not opening properly or not closing properly, or it could be the heart muscle itself that gets inflamed, or it could be the membrane that surrounds the heart, which is actually the most common one that we see is when you have chest pain, sometimes with deep breaths, or and then they do an echo and they say there's fluid around the heart. So that's inflammation in that membrane around the heart. But it could be any of these parts that can be affected with lupus. And some of the ways that we can see if there's inflammation in the heart, the deeper the inflammation is, the more significant it is, the more complications it could have. When it's just the membrane around the heart, that usually is less severe, and the heart muscle itself is still pumping properly. So there's no major risks there for like a heart attack or heart failure. But when it's the heart muscle itself, that's what's called myocarditis, it just means inflammation of the heart muscle itself, then that becomes a little bit more serious. And this is something that we can see with an MRI. That's one of the images that we can do to take a look at the muscle of the heart itself. And the nice thing is that what these arrows point out is you can see it's all bright, but then you see these areas that don't look so great. And those are areas of inflammation. And this is just different views, but it's just to give you an idea of how the radiologist and our cardiology colleagues can identify if there's actual inflammation in the heart muscle. So the MRI is one of those ways. Imaging, and another type of imaging is called a PET scan. So this one is actually nicer and simpler to see. Areas that are inflamed in the body would just look orange or red. So it just picks up on inflammation. And what we have here is a cut, horizontal cut here through the heart. And you can see this is the heart muscle. And you see the orange tint to it. So that shows immediately your doctor that, okay, the heart muscle is inflamed. And this is just cutting it then transverse. And you can see this coronal cut, and it's the same in actual patient. So you see the same heart muscle there looking orange. So that means it's it's inflamed. And why is this important? So if there is heart disease in lupus, we want to make sure that not only heart medications, to put it that way, meaning like medications that treat the high blood pressure, that can help us get rid of fluid, that can treat cholesterol, we want all of those things on board. And that's what in this graph is called the unchanged regimen, which would mean that people are, if you're only being treated with medications that are specific for just the heart function, then yes, we do see some improvement, But this is just showing the decrease in the inflammation, that that we see some improvement in the heart. But if you also add on then medications that we normally use for lupus that are called immunosuppressants to calm down that inflammation further, then we see that we get much better results. You see that it comes down much more than when you just use the regular heart medications that will be used for anybody with heart disease, but not specifically with lupus. So it's important that we know, is there actual inflammation in the heart muscle, so that we can add some other treatments that will make the heart recover faster and better. So so important to keep that in mind. And last but not least, I wanted to mention a little bit about some of the rhythms in the heart. So this is what's called arrhythmia. It just means that the heart is not beating at its normal pace or frequency. So when this happens, what the consequences are that instead of good pumping of the blood with the regular heartbeats, then the heart muscle is just it's beating in a disorganized way, and it might not be pumping the blood properly, and it can lead to some complications. And one good thing with the rhythms, abnormal rhythms in the heart, is that they can be easily identified just with an EKG. So, and that's what we are seeing here. Those are those 12 leads. And it just gives us a pattern there. And from that EKG, we can easily determine if there's any irregularities in how that heart is beating. And this has been looked at, like how often do we actually see that there are abnormalities in the rhythm in people with lupus? And this was actually just looking at new patients. So people that had been diagnosed with lupus in the last years, not more than 5 years. And we see that even early on, there's about 30% that can have some abnormalities in that rhythm. And that's something that's easily detected with just doing that EKG. And that's important because if we do see that, then we know there's greater risk for heart disease and or heart complications. So we can have a closer look and monitoring for whenever there's something to treat, so that we don't get long-term complications. So with that, I'll leave you with this take-home points, and just keep it in mind that with lupus, it's really any part of the heart that can be affected. What's most commonly seen is that membrane around the heart when there's chest pain and we see the fluid in an echo, but it could also be the actual heart muscle, and then that puts us at greater risk. To know that now that people with lupus thankfully live much longer, then heart disease has become something that we need to be aware of and early identify as a common cause of death. Lupus itself is a risk factor for heart disease, even after we account for all those other common risk factors that are associated with heart disease. And because of this, it is important to identify any heart problems early so that we can treat them promptly and, and prevent then long-term damage that could then lead to the heart not working properly. And with that, I will end. And the goal is that we have happy and healthy hearts. And I'll leave you with that.
Thank you so much, Dr. Geraldino-Pardilla. We're super thankful for all the information you shared, and hopefully as people are working with their medical team, they're making sure that they have more informed and empowered now to ask these questions and be sure that they're monitoring their heart health. Someone said cute graphic at the end. So just for anyone who joined us a little bit later, there is a chat box that you can access if you do have questions for the presentation. Please, for either of our presenters, please put them in the chat box. We're going to have our second presentation, and then we will move over into Q&A. So without further ado, I'd like to introduce Dr. Monica Blied.
Thank you so much for having me. I'm glad to be here today. So I am a clinical psychologist. which means I provide therapy and assessment for folks who need it, folks who are living with chronic mental illness and medical illness. And I'm also a lupus patient myself. I have been living with lupus and fibromyalgia since 2012, so it's been 10 years now. And so a lot of what I share with you is me trying to figure this out myself. Yes, I, got a doctorate degree and many other degrees to help me along the way. But, in addition to what I'll be sharing with you as far as the science behind how we can manage our stress and keep our hearts healthy, it's also real life lived experience of, could this work for me? And then if it works for me, then maybe it'll work for someone else. So I'm going to share my screen, and what I'm sharing with you guys today are mind, body, and spirit interventions for stress management. Did you guys know that stress actually impacts our heart health? A bit ago, the National Heart, Lung, and Blood Institute released some research, and it resulted in this article. Can stress really break your hearts? Who has ever heard of broken heart syndrome? Just type in the chat like, yes, I've heard of it. If I had a family member who experienced it, we might think of it of, a couple who has lived for 40 years, been married together, and then, one member of the couple dies, and then within a year, the other member of a couple dies. And colloquially, we say like, oh, that person died from a broken heart, but it's actually really a real thing. It's called stress-induced cardiomyopathy, where because of extreme stress, which can be from grief or shock or anger, that our heart muscle is affected, and our blood flow to our heart is affected, and the symptoms can look a lot like a heart attack. So just as an FYI, anytime you're experiencing any symptoms of chest pain or shortness of breath, just go to a doctor right away, especially since, as Dr. Laura told us, we as lupus patients have increased risk for heart failure and heart problems. So what can you do about it? So I'm going to start with mind, so thought-based, and then body-based, and then spirit-based interventions that you can use. So starting with stinking thinking, thought management, I want us to get in the habit of doing mindfulness, which is being aware of what's happening right here, right now, what is happening around us and within our body and within our thoughts, over mindful mess, or having your mind full of a bunch of mess and worries and anxieties and things that consume us that are not within our control. So how can we do this? We use the theory behind cognitive behavioral therapy and the cognitive triad, which says that what we're thinking impacts how we feel, but it also impacts our behaviors and also what shows up in our body. So if we have the thought, if someone jumps in front of you while you're driving on the freeway, and you have to hurry up and smash on your brakes. If somebody cuts you off, what are you thinking? You can type into the chat, what are you thinking? Let me take a look. Yeah, I haven't seen any responses yet. I used to work with veterans at the VA hospital, and they'll be like saying all kind of colorful words, all kind of 4-letter words that are not love and like, right? And so if we have that thought, like, oh, this person is such a jerk, and they don't care about me, they've just put my life in danger, then what's going to show up in our emotions is we're going to be, really angry, and what's going to show up in our behaviors is automatically our body is going to do certain things. Our heart is going to race. We might have some sweating, some muscle tension. We'll automatically stomp on the brakes so that we don't get in an accident. And then some of the people I used to work with would be like, I'd follow them, chase them off the road. Don't do that. But it shows up in our body and our behaviors. What if we shifted that thought to, instead of thinking like, oh, what a jerk, that person doesn't care about me, to, oh, wow, what if that person is having a panic attack and they're just trying to hurry up and get off the road. They're literally not thinking about anybody else on the road. Or they just found out that their loved one is in, the ICU, and they're trying to hurry up and get there. So how does that then impact what we feel? Maybe we're still, irritated, but it's not to the level of anger and rage. So the intensity of what we're feeling goes down. And then how does that show up in our behaviors, in our body? We're still going to have those automatic responses of keeping ourselves from danger. So pressing on the brake, but our ability to calm down from that stress response, our ability to have our heart rate lower a lot quicker and come back to normal rest and relaxation is going to be a whole lot quicker than if those thoughts are driving kind of this vicious cycle. How do we do that? So I have these 3 R's that I made up but have not yet patented. And these are ways that you can challenge stinking thinking. So stinking thinking is like anything that's in your mind that you don't necessarily want to be there. Now, there are some times when we do need to ponder, reflect, and spend some time kind of mentally chewing on like, okay, well, how do I logistically get to my doctor's appointment next week because, I don't have a ride? Or how am I going to, pay this bill, or whatever the case might be. But then there are also some things that are outside of our control. And if it's not in our control, why are we allowing it to control our thoughts? So what are some things to do when we have thoughts we don't want to be there, or that we need to quiet down? One thing that's not on this list is just journaling. If you can just write down the things that are on your mind, including your to-do list, including your worries, or whatever the case might be, what it does is it signals to our brain, hey, I don't have to hold on to this. I don't have to mentally organize and kind of latch onto this thing, because I can see visually that there's a safe place where it is. So we're giving our brains permission to kind of free up some space. But what are some other things that you can do? One is redirect. You can shift your focus. So that's kind of like if you're having a lot of anxious, depressive thoughts, and you don't want to be thinking those things, just busy yourself. Do something else. So maybe it's, putting together a puzzle, or playing with your kids or nieces or nephews, or, Netflix and chill, whatever the case might be, redirecting your focus, hopefully to something else that you can think of. And again, each of these are temporary. They're going to give you enough temporary relief to be able to calm down what's going on in our body and further protect our hearts and our other organs from the impact of stress. The second is to reframe. That is shifting your perspective. What is a different way that I can look at this? And I shared with you guys what that looks like with the traffic example, but there is another way that it can come up, like, okay, I'm going back to the doctor to get my, lab results. And what if, it says that, now I'm in, stage 4 chronic kidney disease? Or what if it says that, what are all these things, right? We have so many what ifs come up, and that can really torture us, and that can really occupy a lot of our mind. But what if instead, here's another twist on the what if, we shifted that what if to an even if. Even if the lab results show the worst, I've been through hard things and I'm going to make it through another hard thing. I have amazing support system, with me through LFA. I'm going to reach out to Alyssa, or I'm going to reach out to, my community to pray for me or to send meals or whatever the case might be. How can you shift your perspective from the what if to the even if, and remember how powerful you are, and remember how much hope you have. And if you don't have the hope, that's okay. Someone can hold the hope for you, which is why it's so important to be in support groups like this, so that you know that you're not alone. The third is recognize and accept. Okay, and this is where the ticker tape comes in. Like I have on these pictures on the side here where you have like the main, news or weather, and then at the bottom you have the headlines, or you have the main presenter, and the bottom you have the headlines. Sometimes because we have too much GABA, too little serotonin, we're just anxious. The anxious thoughts are just going to be there. So we're not trying to extinguish or totally get rid of them, because then they're just going to surface in our bodies. But instead we accept that they're there. It is what it is, going to be what it's going to be. But what we do is we treat it like the ticker tape, the thing right down at the bottom, and not as the whole picture, not as the biggest part of what's happening in our mind. So yes, I have these concerns. I have this to-do list that I've written down, and they're still kind of, swirling around in my mind. But the main thing that I'm going to be paying attention to for these next 2 days, or whatever the case might be, what I'm going to shift my focus to is the things that bring me joy, the things that make me smile, make me laugh, or just get me to a place that feels neutral, if that's the best that you can do. Okay, let's talk about the body, because stress shows up in the body. So a lot of people have heard of like 4-4-4 breathing, or 3-3-3, like you breathe in 3, breathe out 3, breathe in 3, breathe out 3. That's all great. But what the science shows is that what's most effective actually is when you have a longer exhale than your inhale, because your inhale is stimulating. It stimulates our sympathetic nervous system, whereas the exhale actually stimulates our relaxation system, which is our parasympathetic nervous system, also related to our vagus nerve. And our vagus nerve is attached to everything. And if you can get that toned and better functioning, then you're going to actually lower levels of inflammation in your body, which are raised up by stress and raised up by just the fact that we have lupus. So I want you to all practice with me right now. Go ahead and inhale for a count of 3, and then exhale for 6 or 7, or as long as you can make it, okay? So inhale and exhale. You guys can't see, but I naturally put my hand on my belly, because when you inhale, you want your belly to expand, and that's going to activate your diaphragm muscle, which again lowers levels of inflammation and activates our body's relaxation system. So inhale, belly out, and exhale, belly in. One more time for good measure. Inhale. And exhale, long exhale. Now, there are a few other interventions that are so helpful. One is called the havening touch, and it's like a self-hug. And basically you just put your arms around yourself, and then you rub down, you rub in the downward direction. So I know a lot of you guys have your cameras off, but I'm expecting you to be doing this even though your camera's off. Go ahead and follow along with me. Don't have me doing it by myself looking silly. And you can even close your eyes as you're doing it and just notice if you feel like any like spark or energy or anything like that. What this does is it actually stimulates the hormone oxytocin, and oxytocin is the love hormone. And so you might notice as you're doing this that your brain gets the signal of like, oh, I feel like loved and comforted. And like the same neurochemicals that pop up in our brains when we do like see a newborn baby, or when we hug someone that we do love, when we are in physical intimacy with someone that we love, and we can do this on our own. And again, these are all strategies for being able to activate our body's relaxation system, which is going to limit the impact of stress and reverse the impact of stress inside our bodies. Okay. And then next, there's something called emotional freedom technique, which is energy tapping. And what you do is you take 2 fingers on both of your hands and you're going to be tapping specific meridian points. So these are energy points in your body that are associated with like acupressure, and they actually activate specific parts of your brain to reduce stress in your brain. So that's the amygdala activation, the fear parts of your brain, but then also to reduce your experience of pain, because so much of our physical pain that we experience is actually related to nerve signals in our central nervous system. And so we can help to control our pain by tapping into these brain areas. So go ahead and do it along with me. So tap, 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 and you tap like 5 to 7 times in each section. And if you guys have ever seen like Iyanla Fix My Life, she's done this before on her show, just using the science of it. And then as you're doing it, you can also do positive affirmations like, I can make it through this. I can make it through this. So top of your eyebrow, I can make it through this. The side of your eye, and the picture on the right shows the spot. Sides of your eyes. No weapon formed against me shall prosper. No weapon formed against me shall prosper. You can use under your eyes. It's easier if you don't have glasses on. You can use positive statements from your faith or from you, whatever you need to hear. Excuse me. And then you see the other parts, and I'll share this presentation as well. Excuse me, I need to drink some water. And so this just shows actually MRI imaging that shows that before tapping and after tapping. So before tapping, the areas of the brain that are associated with, for this person, it was for physical pain, were actually quieted after tapping. It actually has a physiological impact. Excuse me. And then there's gentle chair yoga. And for those of you who are familiar with me, you know that I'm certified in chair yoga, and I have some free videos on YouTube for how to follow along. But basically what this does is it gives us some physical movement, some activity, some exercise. And the beautiful thing about this is you can do it while you're sitting in bed, sitting on the couch, or sitting in the chair. And so just follow along with me, where I want you to raise your hands if you do have issues with your heart or vertigo, you're not going to raise your arms all the way up, but you're going to do a goalpost. So just do it this high. And breathe. Now go ahead and clasp your hands behind you. And you may remember this from like PE class. And go ahead and twist to one side. And twist to the other. Okay, let's incorporate the havening touch self hug along with some of our range of motion exercises. So go ahead and start doing that self hug, but then lift your elbows up, twist to one side, twist to the other. Okay, and go ahead and roll your head around in a half circle. And I'm sure you guys have heard so much from your physicians about the importance of exercise. And I just wanted to add more about why exercise, doing what you can is so important. Because when you get vigorous exercise, so any exercise that like raises your heart rate, it not only produces endorphins, which are like the happy chemicals, and increases serotonin, which is the neurochemical, the brain chemical that's associated with both depression and anxiety. So you can self-treat some of those conditions when they're more mild, but it also produces a protein called BDNF, which is brain-derived neurotropic factor. It's a protein that binds around the cells that have been damaged by stress. So there are multiple reasons to get some sort of physical activity. And then spirit and soul. And this is regardless of faith background. It's about connecting and reconnecting with what is meaningful for you and what brings you purpose. Why are you still trying on this faith journey or on this journey of life? Living with lupus is hard. At times it can feel very devastating, but you haven't given up. And there's a reason for that. And, you know, after a while of living with chronic illness, a lot of us have started to see that like life is so much bigger than whatever our limitations are of, you know, not being able to be out in the sun and having chronic fatigue and having to take 4-hour naps and oops, I'm telling all my business, you know, but life is so much more meaningful than that. And we're no longer on the rat race of just doing the next thing, because guess what? We can't. Our bodies say, nope, you're done. And so we appreciate so much more nature and community and the opportunity to laugh. And so what brings you meaning? What brings you purpose? Reconnect with those things. Spirit again, what brings you joy? I'll leave you guys with this quote by Leonard Cohen, who said, one of his songs, ring the bells that can still ring. Forget your perfect offering. There is a crack in everything, and that's how the light gets in. Forget your perfect, well, ring the bells that can still ring. Do what you can. You know, there's a lot we can't do, but do what you can. And forget trying to be perfect. Forget that type A and all the things that, you know, contribute to us feeling bad and feeling shamed and grief for, you know, how our bodies have betrayed us. Because guess what? My mama say, everybody got something. Okay, mine may be visible, yours may be invisible, but everybody got something. There's a crack in everything, but guess what? There's beauty in that crack. There's beauty in brokenness. And I just want you guys to remember that and pursue joy. And just as a little announcement, I do have the opportunity for you guys to learn more about the science and the practice of these things that I shared with you. It's all based on neuroscience research. And I have an app that's coming out, and you can sign up to be one of the first people to experience the app by going to my website, drblied.com/app.
Wow, I feel refreshed. I hope everyone does. Thank you so much, Dr. Blied. That was awesome. So
You're very welcome.
I see that we've gotten some questions during the presentations and lots of affirmations, which is terrific. So Alicia, do you want to kind of start through some of the questions that came through earlier?
Yes, there were a couple questions. The first was from Kelly, and she asked Dr. Geraldino, how often should lupus patients be getting EKGs? And are there any other tests other than blood pressure that should be done regularly if those symptoms are evident?
And that's a great question because there's actually no official guidelines saying if you have lupus, you should be getting EKGs every 6 months, a year. There's nothing really like that, but just a lot of lupologists, people that are treating lupus, what we do is at least get a screening EKG, within the first year or so of diagnosis, and I like to check it yearly. Especially if we know that the lupus has been flaring, that there are some active issues with the kidneys, which we saw there's higher risk. But there aren't official guidelines to tell us how often to do. But I think knowing when there is higher risk, because we know the active inflammation, so that would mean during flares or when the kidneys are involved, that's another time that is risky. And certainly we should be looking into it at those points in time. In terms of what other things, the blood pressure is a good one that of course we're getting every time you go for your visit. But besides that, it's also recommended to check on the cholesterol level. So probably your doctors are checking on that as well. And every time that you see the lupus doctor, they're checking for how your kidneys are doing, which is an indirect way to check for that risk for heart disease. So they will be checking on all the labs there in the blood, in the urine, to see how the kidneys are doing, and then from there they can determine if there's anything abnormal as well.
Thank you. One other from Albina. What products do lupus patients need to use to improve the health of the heart and blood vessels? And are there any supplements that they should be taking?
Not really supplements, but like I was mentioning, we saw that it's both those common risk factors that can contribute as well as the lupus. So we do know that if the cholesterol is high, so as long as that's being screened for, then that's something to be treated. If the blood pressure is high, starting on medications that can treat that, and often knowing that with lupus, there's not only the risk for the heart disease, but also the kidney disease, and they can be intertwined. There's blood pressure medications that are favored because they also have additional properties, like they can also protect for the kidneys and help with if there's leakage of protein in the urine. And so making sure that if there is a blood pressure medication you're on, that it's actually one of those, because it has that double benefit and overall better outcomes. But there's no real supplement to take. One of the things we often check for, during regular visits is vitamin D. The reason for that is not only because, a lot of it comes from the sun and we are trying to avoid the sun, so we often need to supplement it, but it's also that when the vitamin D is very low, then that's also associated with flares of the lupus. And the flares of the lupus on their own, of course, puts us at higher risk. So checking for the vitamin D, and only so if it's low, then to supplement that is also very helpful. And that vitamin D comes, when it's really low, comes with a lot of other symptoms, like it can make you feel more fatigue, even if and more achy. So it's one of those things that we're often requiring to supplement. But other than that, there's no specific supplement per se. The most important thing is to make sure, like Dr. Blied was mentioning, that you are being healthy, exercising, trying to control your levels of stress as best as one can. Even more so during these times that have been challenging. But that is really the most important thing.
Another one just came in. Tanika says, Dr. Padilla, if a patient requests to have an annual EKG screening, oh, sorry, hold on. Whether through their rheumatologist and or cardiologist, and are they denied, what should one do?
So the EKG it's always covered by the insurance. So especially, you know, if I don't think it would ever be denied. It's not something that should be difficult to get. So for sure, your rheumatologist will be on board with getting that. Even if other physicians don't see that there's a risk, don't consider it a risk because they say, well, you're young, you don't need to be worrying about that. But it's something that the insurance always covers. So that is that's shouldn't be a problem. And somebody made a comment on the diet as well. And yes, absolutely, especially if we know that there's high blood pressure, or that that's already a risk factor we have, or that the kidneys are involved. So eating with a low salt diet, making sure we're mainly our bigger portions are the vegetables and the protein and our healthy fats. So knowing what to select there. So for healthy fats, we favor things like avocado, nuts, olives. So those are some of those healthy fats that are encouraged. And you know, in your main portions being the vegetables, and the protein favored being white meat and fish. But yes, all of these things are diet, exercise, mental health, having our frequent monitoring with our lupus doctors that are checking on things that might not give us any symptoms, and they just pick up on whether it's labs or just checking your blood pressure. It's all yes, a group of things that we can look into and address.
Okay, I have time for one more. How serious is a conduction delay, and what action should be taken?
So there's different kinds of the conduction delays. Some of them are very mild, and they're graded by degrees there. But depending on how severe they are, they could be mild all the way to severe. But once they are identified, there's special procedures, and there's different medications that can be done to treat that. So there's you would be referred to a cardiologist that specializes in heart rhythms, which is an electrophysiologist, and there's a lot of things that they can do for that. Sometimes even a pacemaker is needed if there's a big delay. But the important thing is to identify it, because it can be treated.
Thank you so much. I see we have another question popping up, but we definitely want to make sure we have time for our presentation. So we will commit to collecting any additional questions and getting back to you. I think I went through these. So just want to talk a little bit about the Lupus Foundation for those of you who maybe are not super familiar with us, and also just updates for those of you who are. So our vision is a life free from lupus, and our mission is to improve the quality of life for everyone affected by lupus through programs of research, education, support, and advocacy. We have 3 areas that we're really organized around: research, care and support services, and advocacy. And everything we do, we're really working towards specific outcomes. The first one is reducing the time to diagnosis, because we know that's critical in getting patients the attention and resources they need. Ensuring people have a safe and effective arsenal of treatments. And we've had some great progress over the last year, where we've had a couple of new medications approved, as well as an additional use for an existing medication. And so we know that's important, and it's been a long time coming. It's been a very long time that there was really only one on-label medication for lupus. So we know we have to continue to do work in that area. We want to expand direct services and increase access to treatments and care. And to do all of that, we need to expand the funding to achieve our mission. Something that's relatively new is our RAY, our patient-powered research, and this is a way that you can participate and share information that is then de-identified and shared with researchers. So if you've not participated in RAY, somebody can share the link in the chat box. You can take a look. We do know that having the patient voice in research is a critical part of making sure that we have those safe and effective treatments. So this is a way that you can participate. Some of our programs and services, we have an expert series where we have presenters from literally across the country and around the world who present on different topics in podcasts. Those are all available online. If you have not visited, you can go to the National Resource Center on Lupus and type in the expert series and you'll see all the past ones that have taken place. You can also sign up to get alerts when a new expert series presentation comes out. Support groups. Hopefully some of you are familiar with our support groups. I see we have a support group leader on here, which is wonderful. Currently our support groups are all operating online for the safety of everyone. And so you can visit our Northeast page on lupus.org and you can see the existing support groups, and we're hopefully going to have one launching in Connecticut in May. So look for more information on that. We also have Lupus Connect, which is our online community of support. It's available 24/7. It's peers interacting with peers. It is really only monitored from the perspective of bad behavior to make sure everybody has a positive experience. There are over 18,000 members. So you can go in and you can follow a conversation, you can ask a question, you can look for people who are in your local area through a zip code search. So if you have not joined Lupus Connect, I highly recommend it. If you're a patient, if you're a caregiver, if you're a healthcare provider, it's a great community and operates on many levels. I talked a little bit about our National Resource Center on Lupus as the home of our expert series, but there is a wealth of information in there. There are articles, there are podcasts, there are profiles of patients, there are toolkits you can download. You can go in on a curated track. So for example, if you're a newly diagnosed patient, there's a curated track of information that will present to you. If you're a caregiver, if you're a parent of a child with lupus, and then you can use the search function and information is updated all the time. It's a wonderful, wonderful resource. Our health educators are available in English and Spanish. You can reach them through, there's a link on our lupus.org site where you can fill out a form and they will get back to you with a phone call. This is a great place if you have specific information, specific questions about your medication, benefits at work, really anything. They are constantly compiling resources from around the country, getting more and more information to help you on your journey, and it's one-to-one information. You can subscribe to our Take Charge email series, which is all about empowerment, how you can manage your disease. And so highly recommend that you do that. Be Fierce, Take Control is entering its second entity. We'll be updating it, but it is a primarily social media campaign designed to educate women 18 to early 30s about what the signs and symptoms of lupus are, so that when they go to speak to their healthcare practitioner, they've got great information, they can ask good questions, and that will hopefully shorten the time to diagnosis. So how can you help us? We have many, many ways. We have programs for people who are involved in athletics, Team Make Your Mark. If you're an athlete or athletes in the family who like to do walkathons or 5Ks or half marathons or marathons, they can sign up for Team Make Your Mark. Make Your Mark itself is just any type of event that you want to have in your community. And then we talked about advocacy. So advocacy can be as simple as signing up to be an e-advocate, which means that when legislation comes up that affects lupus patients, you'll get an email. Once you've signed up, it will give you some information to fill out, and that way you can contact your local legislator, whether it's your congressperson, your senator, if it's a state issue, your state representatives, and your voice can be heard. In addition, we have a summit each year. This year it will be in June. The application process has not opened yet, but we go to Washington, D.C., and we go up on the Hill and we speak to our elected representatives to make sure that lupus is in the forefront of their minds as they are making policy and deciding where resources go. May is Lupus Awareness Month, so this is a great opportunity for all of us to spread awareness. This year, May 10th, will be both Put on Purple Day and World Lupus Day. It's the first time they're both going to come together. So this is a great opportunity for you to engage with your community. You can take a picture of yourself wearing your purple and share it out on your own social media. If you work for a company or you're part of a community organization, or even if you're in a Zoom meeting, get everybody on the Zoom meeting to wear purple, take a screenshot, tag it with all the hashtags and share it out. You'll see in these photos, we have individuals. Some of these folks are local media personalities who are doing it. If you look carefully, you might even see a couple of LFA staff like Alicia up in the corner. But it's a wonderful way for you to get engaged. And we have toolkits and information. So if you're interested in Lupus Awareness Month, definitely check the website, check your emails, or let us know, and we'll make sure that we find a way to get you engaged. Lupus at Work is a program that we have to help raise awareness about lupus in either your company or for community organizations. We've done it for faith-based organizations. We've done it for libraries. We've done it for fraternities, sororities. We just talk about what lupus is. You know, allyship is really important for lupus. One of the things we hear a lot from patients is even if they're in a great environment and they have a supportive supervisor, sometimes their colleagues are not as understanding and don't understand why one day you could be at work and feeling great and the next day you literally can't get out of bed. So we really want to create awareness in companies and talk about how employers and employees can best support people living with lupus. So if you want to engage your company or your community organization, you can let us know. May is a great time to schedule these because it is Lupus Awareness Month. It can be tailored to anywhere from 45 minutes to an hour. And again, we're currently doing all of these online. And if you like to laugh, and I think that Dr. Blied said laughter was a good strategy. On May 12th, we will have our second annual Laugh It Up with us. This will feature comedians living with lupus. I believe we had 6 last year, 6 female comedians, all of whom had lupus. And this is a great program. So more information will be coming, but you can save the date for this. And then our walks, we're really excited that our walks will be back in person this year, fingers crossed. They will all be in the fall. Hartford will take place at Rentschler Field on the 25th of September. New York City will be back at the Seaport on October 8th. Boston will be out on the Boston Commons out on October 15th. And Norwalk will be at Calf Pasture Beach on the 23rd. And if you don't live near any of those locations, we will have a regional virtual walk that you can join. If you would like to register, you can scan the QR code now, or you can just put info in a comment in the chat box and one of the walk managers will follow up with you. And last but not least, this is just how to stay in touch with us to know what's coming up. You can visit our page, lupus.org Northeast, our telephone numbers here, our email. And I highly encourage everyone to follow us on Facebook and on Instagram. Each Tuesday, twice a month. No, not each Tuesday, but twice a month on Tuesdays. We've been doing a new program called Talk to Us Tuesdays. We've featured a lupus warrior talking about a particular topic. They've included fatigue. They've included how to find a physician when you move. They've included fertility issues, just the different things that are on lupus warriors' minds, relationships. And then everybody can kind of engage with that person and share, you know, ideas and thoughts and questions, and just build community. So definitely encourage you to look for that. And lastly, we do have a survey for this program. And so the QR code is here. I think there's also a link going to be posted in the chat box. We will also send out a link to the survey when we send out the recording. But we always want to improve. We want to learn more. We want to know what's important to you. We want to know what's working and not working. So please do take a couple of minutes to fill out our survey. And last but not least, I want to welcome again our wonderful family member, I keep calling her, Arnita Roberts-Christie from Us and Lupus at GSK. And Arnita's gonna leave us, I'm sure, on a high for our program. So I'll turn it over to Arnita.
Well, that's a really tall order for me to follow. Thank you everyone for staying on. And I know that it is past the hour. However, if you can just hold on with me for just a few minutes, I promise not to keep you long, but just want to review a couple of things that you've actually already gone through with the previous presenters. Oops, sorry. So for those of you that I have not met, I am Arnita Roberts-Christie. I'm one of the patient engagement liaisons here at GlaxoSmithKline. And although I am a registered nurse and have been for a number of years, these few minutes that we're going to be together is not meant to take the place of you having a conversation with your healthcare provider. It's really to encourage you even more than you have been already encouraged. I don't know how much more you can be encouraged by those two powerful presentations, but just to encourage you a little bit more to have that relationship with your doctor. And so in reviewing your role, so at least 30 of you have been here from the beginning. And what that says to me is that you know how critically important your role is on your lupus journey, how critically important it is for you to be engaged, for you to be informed, and knowing that that can lead to better health outcomes. The physician, the second one, talked about journaling. And so there's a number of different ways that you could journal. And I want to remind you that one of the most important things to remember about journaling is that you start. If you have not started already, is that you start and that you continue. And so you see this person here who is probably of my era that we write everything down. But those of you that are of a younger generation, take out your, if you have a smartphone, use your smartphone to record information about how you're feeling. You know, when, you know, lupus lodges in the small vessels of the brain, there's something that can be called lupus fog that can occur. And when that happens, it's a little bit difficult for you to remember things. But if you have an opportunity to write it down or to record it inside your phone, when you get to your next physician's visit, you can remember that. So say if, you know, we're talking about having a healthy heart and how critically important that is, allow the physicians, I want to encourage you to allow the physicians to decide if what you're feeling is related to a particular disease, part of your disease or not. Like, for instance, if you say, oh, I always get short of breath when I run up the stairs, that's just part of running up the stairs. Have you talked to your physician about that? Because it may be something else. And we don't want to put aside of symptoms that we are feeling that could give the physician a little bit more information about what's going on in the inside of your body. We know that lupus has symptoms that show up on the outside, but it's the inside that we cannot see unless we have more invasive tests or more tests that can look inside the body. But you have a voice. And that voice can tell your physician what is happening, and it gives them the opportunity to ask more questions. So I would encourage you to continue to journal or to start journaling if you haven't. It was also mentioned that a healthy heart also can be obtained by what you put into your body. We know, I often hear of a nutritionist that will say garbage in puts garbage out. So if we're not putting healthy, nutritious foods inside our body, it doesn't give the cells inside our body the opportunity to use that nutrition so that we can live our best lupus life. And so involve the whole family in what you're doing. We talked about healthy fats, avocado and oils and lean dairy. And if you go to the grocery store, shop on the outer aisles of the grocery store as opposed to the inner aisles where processed food is. Processed food does not have the highest nutritional value that your body needs in order to fight off bacteria, viruses, and even fight off a flare. And if you have questions about what foods might be more nutritious than others, talk to your healthcare provider about possibly seeing a nutritionist. GSK, or Us in Lupus, GSK has a program called Us in Lupus. And just like with LFA, that program has a plethora or a lot of different resources, whether it's a Facebook community, an Instagram. We even sometimes have people post TikToks on there. But oftentimes we'll have warriors just like yourself post statements on. And this particular statement says, keep a log of your symptoms, watch what you eat and drink. When there is a symptom, be sure to log what you've eaten so that you can track your flares. Because flares are not just by our external environment, it could also come from what we're putting on the inside. There is a very restorative factor to sleeping, to getting enough sleep. That helps the body to rest and to restore, and it helps the heart to rest and restore. And I would encourage you to turn off your alarm clock if you can on a weekend to find out how much sleep your body actually needs. Set the stage for sleep. An hour before it's time to go to sleep, turn off your phone, turn off the television, reduce that noise that's coming in, and set a mode or an atmosphere of rest where you're telling your body it is time to wind down because you are preparing for a good night's sleep. Some people will put on music, easy listening music. Others might light a candle. Others may light certain fragrances, but whatever you need, or whatever you might try to relax the body so that you can give your body the restorative function of sleep. I was, as I talk about this, we learned a little bit about mindfulness. Actually, we learned a lot about mindfulness. And I want to say this first statement out loud. It says, to be mindful is to be aware of your thoughts and your situation without judgment. We know that this lupus journey is not an easy one. And sometimes you can, internalize what you're feeling and feel bad about yourself and say, oh, I don't want to tell my doctor about what I'm feeling again, Arnita, because I've already said this, or, I can't go hang out with my friends and, this is happening again. But to be mindful and to be present right where you are is to do it without judging what you're experiencing. It's to experience where you are with acceptance and again, without judgment. When you go for a walk, notice around you as we're in the spring and we're noticing, the birds are chirping, and listen to the birds chirp. And you may be able to hear that there are different chirps or different sounds that they make. And this is what it is when you are mindfully being present right where you are. We learned a lot about chakras. We learned about tapping and EFT, and I would encourage you to be present right where you are. Self-appreciation is what I want to leave you with. having a chronic condition requires self-love and it requires self-confidence. I love the movement of putting your arms across yourself and then just really gently stroking yourself, as we are in or have been for 2 years in this space of physical distancing. Sometimes we may not have been able to have a loving hug from someone else, but as we were taught today, you can do that for yourself. You can put your arms around yourself and just gently speak to yourself in a very kind voice, a very loving voice. Touch yourself with touches of love, and know and try your best to stay positive in this time of stress. And my last slide, Sue was sharing with you about QR codes, and I too have some QR codes in front of you. If you've never visited the Us and Lupus site, or if it's been a while since you visited, on the very far right, you can sign up to receive a lupus guide. So take out your phones. I have mine. You can put it right up to the screen and it will take you right to that site. You can get tips about talking about lupus, not only on the Us and Lupus site, but of course on the LFA site, reading more about it. And there is just a lot of information. So I want to thank you for hanging in there with us. I know we're beyond the time, but I really do appreciate you taking the time to learn as much as you can and be an engaged patient. So back over to you, Sue.
Thank you so much, Arnita, and thank you for your support and your partnership. We're just so grateful. We have amazing people presenting to us. We have amazing people participating and sharing their experiences. And we know that community is so important. So we're so happy that you're part of our community here today, and we hope you continue to be. So I wish everybody a wonderful day. And if everybody wants to unmute and give our presenters a big round of applause.
Thank you.
Thank you to everybody. Have a
Thank you.
wonderful day.
You're welcome.
You too.
Thank you.
Thank you.
Thank
You're
you.
welcome.